Good afternoon, everybody. The ISMA is happy to provide today's webinar on navigating the 2022 Medicare open enrollment. I'm Tom Martins, the Director of Insurance at Indiana State Medical Association, and joining me is Donna Mallinckrodt, ISMA Medicare Specialist, who has committed herself to educating and assisting ISMA members and their spouses about ISMA-sponsored health insurance, especially those who are or who will soon be on Medicare. Please note that CME is not being offered for this webinar. The webinar is being recorded and will be available on the ISMA Insurance Agency website. The slide presentation for today's webinar will be saved as a PDF file. So just let us know if you're interested in getting a copy of that, and we'll be happy to email that to you. This presentation contains basic Medicare information. It's not a substitute for supplemental plan materials, materials provided by Medicare, or materials provided by an employer. This presentation should not be the only source of your Medicare education. If you have any questions during the webinar, please submit them through the Q&A button, which is located on the bottom of your screen. Questions will be addressed at the end of the presentation. So with that, let's get started. As physicians and spouses approach age 65 throughout the year, and especially during the Medicare open enrollment period that we're in right now, we receive quite a few calls with questions about Medicare, Medicare supplemental coverage, and Medicare drug plans. About this time last year, we hosted a webinar to talk through these topics. We had good participation and decided to do it again this year. So we're delighted that you could join us today and full information. All right, so I'll start out with an interesting factoid. Medicare was started in 1965 by President Lyndon B. Johnson. Donna, what else can you tell us about Medicare?
Sure. So Medicare is a federal health insurance program that helps with the cost of health care for individuals 65 and older. The Centers for Medicare and Medicaid Services manages Medicare. After someone is enrolled, they'll send out a Welcome to Medicare packet in the mail along with the Medicare ID card. They'll also receive the Medicare and You Handbook with important information about your Medicare coverage choices.
Gotcha. And now, who is eligible for Medicare and when do they become eligible?
Sure, good question. So individuals turning age 65 are eligible. Individuals retiring after the age of 65 who were previously covered under a large group employer health plan. And the third group is individuals under 65 who qualify for Social Security disability.
Very good. And next, can you give us a quick overview of the different parts of Medicare?
Sure. So Part A is basically hospital insurance. It covers medical care in the hospital and skilled nursing care following a hospital stay. Part B is referred to as medical insurance, and it covers things like doctor services, outpatient care, ambulance services, chemotherapy, and some diabetic supplies. Part B pays about 80% of Medicare eligible claims. Now, Part C is a Medicare Advantage plan, which is an all-in-one alternative to original Medicare. These bundled plans include Part A, Part B, and usually Part D. Subscribers stay within an HMO or PPO network, and most plans offer some extra benefits like vision, hearing, and dental. And Part D is a prescription drug plan offered by an insurance company. Part D plans are most often paired with original Medicare and Medicare supplement plans.
Thanks. Yeah, I find it helpful to keep in mind that Medicare Part A and B are provided by the federal government. They're sometimes referred to sort of like a couple, like salt and pepper, as original Medicare. So anytime you hear original Medicare, that's referring to Medicare Part A and Part B. On the other hand, Medicare Part C and D plans are offered by insurance companies rather than the federal government.
That's correct. And Part D is also an optional enrollment. Subscribers are not required to have prescription drug coverage.
Good point. Yeah. So when it's the right time for an individual to apply for Medicare, how do they go about doing that?
Sure. So the easiest way is to enroll online at www.ssa.gov/benefits/Medicare. The second easiest way is to enroll through Social Security by calling 1-800-772-1213. And the third way is to just go on into your local Social Security office if it's open, and you can apply in person. And you might want to call Social Security ahead to make an appointment. And I'll also mention that individuals who have not worked 40 quarters or 10 years might want to apply for Part A benefits under a spouse's work record. They'll need to apply by either telephone or in person at their local Social Security office.
Okay. So we just talked about how to enroll in Medicare. Now let's zoom in on some specific situations. So the first is applying for Medicare at age 65. A physician typically applies for Medicare at age 65 when they're in one of three situations. First, they're retired, or second, they're still working and they receive health insurance from an employer with fewer than 20 employees, or third, they're still working, but they buy individual private health insurance on their own and don't get it through an employer. So when does a physician in any of these three situations enroll in Medicare?
So when someone is turning age 65, the initial enrollment period lasts for 7 months. It begins 3 months before the month they turn 65, includes the month of their birthday, and then it ends 3 months thereafter. Coverage begins on the first day of the month that the subscriber turns 65. So using an example of a birthday on November 17th, Medicare will actually begin on November 1st. But however, if the birthday is on the first day of the month, coverage will begin on the first day of the prior month. So if a birthday is on November 1st, coverage actually begins on October 1st.
Mm-hmm. Okay. And if an individual is already enrolled in Social Security, they'll receive their red, white, and blue Medicare ID card in the mail about 12 weeks before their 65th birthday.
Yep, and they don't have to do a thing. It will be mailed to their home address automatically.
Okay. The other very common situation that we see is a physician who is still working at age 65, and they receive health insurance from a large employer that is technically an employer with 20 or more full-time employees or equivalents. When a physician in this situation reaches age 65, they have two options. The first option is to continue their employer-provided health insurance, which will continue to cover them exactly like it did before they turned 65. Or the second option is to waive coverage through the employer, start Medicare as their primary insurance, and purchase Medicare supplemental coverage. So Donna, what are some things for physicians in this situation to consider as they decide on one of those two options?
Sure. So if a spouse or children are currently on the group health plan, it might be easier just to remain with the employer plan. But for most subscribers that are continuing to work, consider performing a cost-benefit analysis. That's basically just a comparison between your employee health insurance contribution and benefits to what Medicare would cost along with those benefits. And don't forget to take into consideration the annual deductible in the analysis. You might find that signing up for Medicare at 65 makes the most sense financially.
Okay, that's good advice. And for a physician who decides to kind of take that first option and continue their health insurance through their employer, after they turn 65 until they retire, how do they enroll in Medicare when they do retire?
Yep, they enroll in Medicare by contacting Social Security. And although Medicare provides an 8-month Medicare special enrollment period, my advice is that the physician should contact Social Security as soon as they know what their retirement date will be. It does take a little bit of paperwork to get the process started because of the previous coverage. And so, as many things in life, sooner is better than later.
Yeah, absolutely. We've learned over the years that there are a few important things that individuals who have health savings accounts should know when they become eligible for Medicare.
Yeah, so an individual with a health savings account who continues to work for an employer after the age of 65 can continue to make pre-tax contributions as long as they do not enroll in Part A, Part B, or Social Security benefits. And HSA funds can be used to pay for eligible Medicare medical expenses and Medicare Part B and D premiums and Advantage Plan premiums. But HSA funds may not be used to pay for a Medicare supplement plan.
So going back to the first bullet, and I just kind of stress this because it's come up several times over the years. When an individual continues to work for a large employer after they turn 65, they have the option to start Medicare Part A at no cost, because basically you're paying into Medicare during all the years that you're working, and that ends up paying for your Medicare Part A. But if you want to continue to make contributions to your HSA after you turn 65 while you're working, you just have to make sure that you do not start Medicare Part A or Part B or Social Security benefits. And then you're able to continue to make those contributions.
Correct.
And there's one more thing that's good to know for individuals who retire from a large employer after age 65, especially if they have a health savings account. Can you tell us more about that?
Yeah, so if you retire after age 65, Part A coverage starts 6 months back from when you sign up or apply for benefits from Social Security. So what that means is, using the example, if you determine your retirement date to be July 1st and you apply for Part B starting on July 1st, Part A is actually going to start 6 months before on January 1st. So if you have an HSA account, you'll want to stop contributing 6 months before applying for Medicare or Social Security benefits.
Mm-hmm. All right, good. So when a physician is ready to start Medicare and some kind of supplemental coverage, what are the two main approaches or options?
Yep, so there's two types of Medicare coverage. The first we've already mentioned, called Original Medicare, which consists of Part A and Part B insurance. Most subscribers will purchase a Medicare supplement, like the ISMA Medicare supplement, to help pay out-of-pocket cost. About 70% of subscribers also enroll in a separate prescription drug plan, known as Part D. Now, the other type of Medicare coverage option is called a Medicare Advantage Plan. And for anyone that turns their TV on at this time of year, they're really being advertised quite heavily during the open enrollment period. But a Medicare Advantage Plan is an all-in-one alternative to Original Medicare and is administered by a Medicare-approved insurance company. These bundled plans include Part A, Part B, and usually Part D. And most plans offer extra benefits like vision, hearing, or dental.
Okay. The first option you just described involves Original Medicare, Part A and B, plus a Medicare supplement like the ISMA-sponsored Anthem Medicare supplement and a Medicare Part D drug plan. So do you want to talk more about the ISMA-sponsored Anthem Medicare supplement?
Sure. So the ISMA Medicare Supplement is a high quality, affordable health plan designed just for ISMA members and their spouses. Medicare covers only 80% of claims, and so the ISMA Medicare Supplement is designed to pick up the other 20% of eligible expenses. ISMA currently offers a first-year discount for members who are new to Medicare, and we've added a second and third-year discount as well. So with the discount, subscribers at age 65 will pay a premium of $120 per month and a Part B deductible of $217 per year. And subscribers can go to any physician that accepts Medicare assignment without a referral.
Mhm. And then let's talk about a few things that that make the ISMA Medicare supplement stand out from other supplements.
Yeah, so there's a few additional benefits. The first is Silver Sneakers Health Club membership with participating fitness centers across the country. And that's proved to be very popular with ISMA subscribers. The second is travel services outside of the US with no maximum lifetime benefit. And the third is a brand new benefit that we're adding for 2022. Its Anthem Blue View Vision benefits include an annual exam with a $5 copay, $130 allowance for frames, lenses with a $20 copay, and discounts for upgrades and add-ons, progressive and anti-reflective lenses, and discounts on additional pairs of glasses, and $130 contact allowance.
Wow. We started talking about adding a vision benefit about a year ago. And we're just really delighted that we're going to be able to do that starting in 2022. I think that that's going to be an important benefit for a lot of people who have the Medicare supplement. And we're ISMA and ISMA Insurance Agency are really trying hard to make this plan something really special. And it really, with these benefits, it's a plan that you can't get anywhere else. So yeah, we're very excited about that.
I am too.
The second option that you described earlier was a Medicare Advantage plan. Lately, as you mentioned, there's been a lot of commercials about those on the TV, and they seem to cover a lot of services at a low cost. But what's the catch?
Yeah, Advantage plans are sometimes referred to as a pay-as-you-go plan. And that means each time you see a provider, you may have copays for medical services. You may be required to use a limited network of HMO or PPO providers, and you'll most likely have a deductible for a hospital stay. You probably need referrals to see a specialist and prior authorizations for hospitalizations and tests. And most plans also have an out-of-pocket maximum, which could be thousands of dollars. And it's very important to note that the plans can choose not to cover the cost of services that the insurance company doesn't consider to be medically necessary.
Yeah, so I think that there's a place for the Medicare Advantage plans, but most of our members, prefer to go the kind of the first option with the first option, which is original Medicare plus a supplement plus a drug plan. And if they go with the ISMA Medicare supplement, as we talked about earlier, one of the nice things about that is that they know upfront what their costs are going to be, or their maximum cost for the year, because it's going to be the premiums that they pay plus potentially a $217 deductible. But other than that, for eligible expenses between Medicare and supplement, everything should be covered in full, except for the drugs, which again, you buy the separate drug plan for.
Correct.
All right. So for a physician who considers options and decides to apply for the ISMA sponsored Anthem Medicare supplement, how do they go about doing that?
Yep. So members and spouses insured through the ISMA individual plan are automatically transitioned to the Medicare supplement plan when they turn age 65. So they'll receive an ISMA information packet 3 months before their birthday, reminding them to enroll in Medicare and how to do so. ISMA members not insured through ISMA should complete an Anthem enrollment form for the supplement. Underwriting approval is required for all new applicants.
Mhm. And just one other thing we'll point out here is for a physician who applies for the ISMA Medicare supplement who has a spouse who is under the age of 65, if you give us a call, we'll be happy to discuss with you options for them. Something that physicians should definitely know about ahead of time is the income-related monthly adjustment amount, or IRMA. What can you tell us about that?
Yeah, so IRMA, it simply means that higher income earners will pay more for Part B and Part D. So Social Security determines an IRMA based on the adjusted gross income reported on IRS returns 2 years before the year that they start paying IRMA. So if someone was applying for Medicare in 2022, Social Security would look at the returns from 2020. So we have a document called FAQ Medicare, frequently asked questions about Medicare, and that document includes specific IRMA amounts according to income level. You can find that document on ismaia.com or click on the link found on the Medicare supplement page.
Yeah, and I understand that 2022 figures haven't been published yet, but once those are available, we'll be updating the FAQ and we'll have that information available there.
That's correct.
Yeah, so a little bit more about the IRMA. So if a physician has a substantial reduction in their income after they start Medicare because they retire, for example, is it possible for them to request a reassessment of their IRMA?
Sure, and this happens all the time. So individuals can submit, it's actually a form you can find online, or I can email one to you. It's called a life-changing event form, and it's known as the SSA-44 to apply for the reduction in IRMA when income is reduced. And retirement is one of the reasons given on the form for a reduction in income. I've also discovered that if you complete the form, it takes several months before the adjustment is actually made. But I have been told from physicians when they've completed the form that usually an adjustment was made.
Okay, great. So we talked earlier about Medicare Part D drug plans. Can you talk about some of the reasons to consider buying a Part D plan?
Sure thing. So original Medicare and Medicare supplement plans do not include prescription drug coverage. So individuals may want to buy separate coverage through a Medicare approved insurance company. Medicare drug coverage is an optional benefit. So if subscribers decide to delay enrollment, they'll have to pay a late enrollment penalty later on when they do decide to enroll. And if you enroll after age 65, because you're still working, you'll receive a questionnaire from the insurance company that needs to be filled out and returned to confirm your prior creditable RX coverage through the group health plan. If you miss that letter and fail to send it back, you may get charged a penalty.
Mm-hmm. And something that we talked about yesterday that I really hadn't realized, it was like a light bulb came on when we were talking about it, was the fact that there is an IRMA, an income-related adjustment for not just Medicare Part B, but also Medicare Part D. So a physician who has a high income and who doesn't take any prescription drugs, they'll want to take that into consideration in deciding whether to go ahead and start a Medicare drug plan, when they're first eligible, or if maybe they want to wait. Even though they'll pay a penalty, uh, they won't have to pay the higher premium for, just to have a drug plan to avoid the penalty. So
Yeah,
that's
that's correct.
yeah, something they'll want to, take into consideration. Individuals can buy or change their drug plan during the annual Medicare open enrollment period that we're in right now, that goes from October 15th to December 7th. Why is it important to use the online Medicare Plan Finder tool during each annual open enrollment period, or at least some of the open enrollment periods, to select a plan for the following year?
So insurance companies can move drugs on and off formulary and change tier level assignments, which directly impact what you'll pay out of pocket each year. And just because a plan covered a particular medication in 2021 doesn't mean that it's going to cover that same medication in 2022. The other reason is that the plans vary enormously in the copays they charge. And the most effective way to make a comparison is to use the online tool on Medicare's website. So the Medicare Plan Finder is very easy to use, and it automatically recommends the lowest cost plan that will cover your medication in the coming year. And I've just recorded a video on how to use the Medicare Plan Finder. And you can find the video at ismaia.com/videos.
Mm-hmm. And based on our conversation yesterday, I understand that you may have to re-record just a little bit of that and have our IT guru kind of swap out a little bit of video for you, because they've already made some changes to that website.
Sure. So probably about 48 hours after I recorded the video, Medicare made changes to the Plan Finder, and Medicare makes changes and I think improves the Plan Finder on a regular basis. So if you are using the video to help yourself find your way through the Plan Finder, about the first 3/4 of it is spot on. It'll show you how to get into the site and how to get to where you need to be. But the part that is actually changed is the very last part, where we go through the Plan Finder information. And as always, if you have any questions as you're looking at a recommended plan, just feel free to give me a call, and I'll be happy to discuss what everything means.
Yeah, the tool, we really encourage people to use this online tool, because it will ask you what specific medications you take, the dosage and the frequency. And after you plug all that information in, it goes out and searches through the formularies for all the different drug plans that are available to you, and it calculates what your total out-of-pocket cost is going to be for the premiums, plus your deductibles and copays and so forth. And it does a great job, amazingly, of telling you which plans are going to be the most effective for you.
Yeah, I completely agree. It's a great tool, and I hope everyone at least tries to get in there and use it. It'll solve a lot of problems each year during open enrollment.
Yeah, and they can use your video and play a little bit, stop it or pause it.
Sure.
Hop over to the website and kind of go back and forth, and yeah. All right. So while ISMA members and spouses are our customers, and we spend most of our time helping them with their own policies, occasionally we get calls from members or spouses who are trying to help a parent or a family member. What advice do you have for them?
Yeah, so start off by determining if the family member has limited income and resources, as the state may help pay their Medicare premiums, or they may qualify for extra help to pay for Part D drug coverage. One of the most important things you can do is just explain the difference between the cost with original Medicare and the Medicare Advantage plans. If original Medicare is preferred, discuss drug coverage and explain Medicare supplemental options. And if an Advantage plan is preferred, research the PPO and HMO options to determine if any of the networks include the family member's current physicians.
Okay, yeah, that's helpful information. Last year, we put together a series of videos on various topics related to Medicare, starting Medicare, and Medicare supplements, pretty detailed information. And those videos are available on the ISMA Insurance Agency website. So we have the address here and the list of those videos. We encourage you to watch those if you're interested. We usually tell people, a good time to do that is just before you go to bed, and might help you to get a good night's sleep. And with that, we're ready to answer questions, and I do see that we have several questions that have come up here. So it looks like the first one is, your supplemental plan is for traditional A and B, or is it classified as an Advantage plan? And I can answer that one. It is not an Advantage plan, but I will say that we're trying to make it like an Advantage plan from the standpoint that we're adding extra benefits that you don't typically see in a Medicare supplement. So most Medicare supplements are called Medigap plans, and they have letters like Medigap Plan G, and I don't even remember what the other letters are. But we basically modeled the ISMA Medicare supplement after the Medigap Plan G, but then we added the additional benefits. And so we're just trying to kind of make it the best of both worlds. We have another question. How or when can I change from traditional to Advantage plans? And is this limited? Donna, you want to take that one?
Yeah, well, you can certainly change to an Advantage plan during open enrollment. And what you might want to do is contact the Advantage plan that you're interested in enrolling with, and give them a call on their customer service phone number and ask if they can take applicants at any time during the year, or if there's only certain times that you can enroll. But certainly, if you wanted to enroll in an Advantage plan, you could do so on January 1st of any year.
And for someone who has enrolled in a Medicare Advantage plan, who decides that they want instead to go to a Medicare supplement, no, we've had some physicians who've made that decision. They can apply for the ISMA Medicare supplement. Actually, doesn't even have to be during the Medicare open enrollment period. They can do that at any time during the year, and we start new policies on the first day of each month. And if they wanted to go from an Advantage plan to a Medigap plan, that would be limited to the open enrollment period, right?
Yeah, so they could apply from an Advantage plan to a Medigap plan at open enrollment. But I also have to stress that switching from Advantage to original Medicare and a supplement is subject to underwriting. And so the reason I caution you is because in the event you suddenly, have a medical issue and you decide, okay, well, I don't want to have co-pays or, out of pocket, meet my out of pocket maximum each year. So now it's time for me to switch over to a Medicare supplement plan. Because you have to disclose medical history for at least the last 5 years, there's a chance that if it's a very important medical diagnosis, you may not be approved. So it's better to switch to a Medicare supplement plan beforehand than to wait until you already have a medical issue.
Yeah, that's a good point. All right. And then let's see, another question is, if I don't start a Part D plan at age 65, can I start in subsequent open enrollment periods? And then what about a penalty?
Yeah, and so you can start any year that you choose to add on January 1st. Open enrollment, as everyone knows by now, starts October 15th and runs through December 7th. So you can enroll in a plan, and you will be charged a penalty for each month that you went without coverage. So if you go for 40 months, it's basically 1% of the average premium per year times 40, and so it can add up. What I usually, as a licensed insurance agency, what I recommend our subscribers to do is just to enroll in the lowest cost Part D plan out there. There's a plan available in the state of Indiana called SilverScript Smart RX, and they charge $6.80 per month. So for well under $100, you could still have a plan that offers credible coverage. That's $100 per year, by the way. You can still have a plan that offers credible coverage, and then you don't have to worry about the penalty. The penalty is a lifetime penalty. So, if you're going to, eventually say you wait till 70 years old to enroll in a Part D plan, and if you're, alive well into your 90s, you're going to have 20 plus years that you'll have to pay that penalty. So, consider just enrolling in a low-cost prescription drug plan, and of course, for physicians, you have to take IRMA into consideration as well.
All right, and then another question: can you use HSA funds for Part D premiums? And I think we had a slide on that, and I believe you said that you can use HSA funds to pay for Part D premiums.
I believe that you can. Again, there's in reference to Part D, there's a phone number for customer service on the back of your card. So you might just want to give your customer service a phone call for the Part D plan and just verify that with them. But I believe that you can use HSA funds to pay for Part D premiums. The only thing that I'm aware of that you can't pay for with an HSA account is a Medicare supplement plan.
Mm-hmm. Right. Okay. Let's see. And do we still offer dental for 2022? Yes, we do. The dental plan is an optional plan. So it is still going to be available, for those people who want to purchase it. The price is going to be held at $40 per person per month. Yeah, we didn't mention it in the presentation because the benefits we did mention, the silver sneakers, the foreign travel benefit with no lifetime limit, and the new vision benefits, those are all baked into the Medicare supplement. Does the ISMA supplement cover skilled nursing?
Yes.
Yeah, there's some stipulations there which are pretty standard, that you have to go into a skilled nursing facility after at least a 3-day hospitalization. There are some specific requirements, but yes, it does cover skilled nursing.
Yeah, and I'd also like to add that there is a difference between custodial nursing care and non-custodial. So if it's a nurse that comes into your home after a hospital stay, that is covered. But if you're caring for or if you happen to be aging and you need some additional assistance, just with bathing or getting dressed or cooking food, that is not covered under Medicare. And so just to understand the difference between custodial and non-custodial. So the ISMA plan does care for an educated RN to come into your home and provide real nursing services, versus it does not cover services such as from someone that's going to come in and help someone bathe or dress every day.
Yeah, thanks for clarifying that. We have a question from someone who is currently insured in the ISMA individual plan, asking when their spouse goes on Medicare in June, what do they need to do to change to the Medicare supplement? And we keep track of everybody's birthdays and send out letters ahead of time just to remind people about this, but we'll automatically move them to the ISMA Medicare supplement. Of course, if they choose to go another route like a Medicare Advantage plan or a Medigap plan outside of ISMA, you just need to let us know, and then we just won't start that Medicare supplement. Someone has asked, what resources does the ISMA have if Anthem, if Anthem refuses to cover a claim? And that's a great question. One of our team members, Jolene Collins, is our kind of our claim specialist. And so, basically what we recommend is that because Anthem processes the claims, the first step would be to contact Anthem, call them at the customer service number on the back of your ID card, and basically appeal to them. They have certain steps that you can go through, but if you feel like you're just not, like Anthem is not being responsive, and you want some help, Jolene will be happy to kind of go work as an in-between and try to keep the communication going both ways. And she has helped a lot of members work through a lot of claims issues. Okay, and then someone has said they thought that there was not a Part D penalty if you didn't sign up at age 65, as long as you showed proof of enrollment in your employer's health plan.
Yeah, that's completely true. So if you have credible coverage through a group health plan, you will have to present a documentation to, I'm not sure if it's actually to Social Security or upon enrolling in a plan. And we also talked about the fact that if you enroll after 65, the drug plan will most likely send you out a letter. And so it's important that you complete the letter and send it back to them. And they may ask for documentation for your drug plan, and especially the date of termination.
Mm-hmm. Yeah. Okay. And then what suggestions do you have for nursing home coverage plans? These were very expensive. Has anything changed? So, yeah, that's a great question. I think what you're talking about there is long-term care insurance, and long-term care insurance has gotten very expensive. My understanding about that is that, they started out somewhat affordable, and then after 20, 25, 30 years, people actually started using the benefits for those plans. And so the insurance companies have in turn raised the rates significantly. ISMA has worked with a couple of different agents who specialize in long-term care insurance over the past 20 years or so. And the first one that we work with was able to help several ISMA members. The one who we worked with most recently, he was able to talk to a lot of ISMA members and answer their questions. as I recall, there were probably about 40 conversations that he had with different ISMA members, but none of them ended up buying long-term care insurance through him. It's, you know, it's just a difficult situation, I think. And if you want to just send me an email, after the webinar, I'll be happy to reach out and see if I can find a contact for you. But yeah, that's kind of my knowledge about the state of that right now. And then let's see. Okay. It looks like this is the last question. If moving to a Medicare supplement mid-year, when and how do we start the Medicare Part D application?
Yeah, and I'm assuming that question is referring to someone turned 65 mid-year.
I think so. Yeah.
Yeah, and so basically you would be enrolling in Part D as a new subscriber due to age because you're turning age 65. So the only requirement for enrolling in a Part D plan is to have a Medicare ID number. So if you're enrolling, let's say your birthday occurs in July and you're enrolling for Medicare Part A and B to be effective on July 1, then as soon as you receive your Medicare ID number, you can go on to the Medicare Plan Finder and find the plan that looks the best to you, and click on the enroll button and just go ahead and enroll. It's as soon as you put in your Medicare ID number, it's because Part D is actually enrolled through Medicare. Medicare will know that you're having your 65th birthday in sometime during the month of July. And so it'll just start in July.
All right, terrific. Well, I think that's all the questions. So we have our contact information here on this slide. We want to thank you all for participating today and for your good questions. Transitioning to Medicare can be confusing and difficult, but we hope that today's discussion will make it easier for those of you who haven't already done that. And we hope the information about choosing a Part D plan was helpful, and hopefully everybody was able to learn something new today. Again, if you have any questions down the road, please feel free to reach out to us. And thanks again for joining us. Hope you have a great rest of the day.